Alrighty guys, so we are going to play with some superficial threads. These are all PDO threads, so they are going to stimulate collagen on the superficial level. We're going to play with smooth threads, we're going to play with a couple of twist threads, we're going to play with some mesh threads as well. And then we're going to lastly do brow lifting. More brow shaping, kind of the cat eye, the foxy eye. People are talking about that. We won't do it as extreme as that, but we'll give definitely some nice lateral lifting to the brow area. Okay, so we're going to start off with mesh threads. So mesh threads are simply a bunch of different threads. I think it's like 20 to 100 threads that are all intertwined together to make a mesh in a circular pattern. They're going to create a lot more volumization into an area that you're going to place. So we're going to place some in the nasolabial folds, and we're going to place some actually on her cheeks, because we've done her cog lifting, the barb lifting, what I call foundation lifting. We're going to now follow it up with some superficial aspects of it. Okay, so here we go. So with these are 19 gauges, and so what that means is you're going to have to numb the patient up. I typically already, as you can see, have done some lighter with epi into this area, and so we're already starting to numb her up, because we definitely need to create a port site for the patient on these. So we're going to create some port sites on the patient. Go ahead and turn for me this way. I'm actually going to come in from laterally. And you want to address this into that subcutaneous tissue layer. You don't want to go too superficial so that you see the thread, but you don't want to go too deep that you don't get the nice volumization from the thread. Place it on there. Okay. And so these mesh ones, the ones that you have to understand is that there is no cutting with this one. So that means that when you place the thread in there, you need to make sure that you place everything in there. So you need to start a little further beyond the port site. So if I want to hit here, I'm actually starting here so that I can push the thread and it stays into there, because you need all of the thread to be hidden underneath in that subcutaneous tissue layer. So you want to start from a little bit. If you know, like, this is the area that I want the thread to be in, I'm probably going to start a little bit lower and then push the thread up a little bit higher. Okay, so we're going to start off with a little bit into this area. And as you can see, grab onto tissue subcutaneously, and we're going to just mobilize it into the right place. And see, you kind of hub the tissue, and you can push a little bit more so if you wanted to go into a little bit different of a place. I do, so I'm going to do that. I'm going to hold down, twist it, and then I'm going to pull it out, and the thread is already in there. So that's kind of what you want to do with your mesh threads. I'm going to do the same thing over here, because I want to create a little bit of volume into this area. So a little bit through the tissue, subcutaneously, placing it right into this area that I want it. A little twist, and come out with your thread. And so you're creating some lifting volumization with the thread into this area. I'm going to do a little bit more down in this area. We're going to grab another thread, another mesh, and we're going to create a little bit of volume in here. Deep dermis subcutaneously. I want it to come right into this area, stimulate collagen, twist it as you're coming out. Beautiful. So we've created a nice little mild volumization on the surface with mesh thread. So mesh is great if you want to add volume to an area. It will definitely do a nice job of adding volume into an area. You can definitely do it in the nasolabial fold. So let's create a little puncture site right into this area. A little pinch. And let's take her mesh. Take the mesh. I'm going to pinch the tissue up, puncture through, subcutaneous, deep dermis, and we're going to follow it and fill up this line where we want it to go. So I find that I want to go a little bit deeper. You push through the tissue a little bit more, and you kind of just hold it there. And voila, threads placed beautifully. And you can place meshes side by side by side. You can place meshes on top of each other to give volume. Whatever you want to do, the meshes will create more volume instantaneously because they are a mesh type of a thread. And so that's where that works really, really pretty. Now we're going to play with a little bit of smooth thread. So these are typically 29 gauge. There's 25 millimeter, so smaller. There's 38 and there are 60, depending on how big of an area. 60 probably you'll use when you're using body or really, really long faces or stuff like that. But most of us probably use 25 to 30, 25 and 38 millimeters to do threads. So remember, what you're trying to do is stay in the superficial tissue range. So we're going to pinch, and we're going to place it. And this is where you see on Instagram, people are doing all these all these smooth threads, and they're playing in this area. You do get some mild lifting, so it's not for heavy lifting, but for some mild lifting because you want to create a kind of a mesh pattern. So you can see I'm kind of creating a little bit of a mesh in here. So we're going to place about 4 or 5 one direction, and then we're going to place another 5 in the other direction. Okay, now we're going to place it in the other direction. And so when you place this mesh, what you're doing is you're creating more collagen in a mesh network. So kind of like a scaffolding type of effect is what we're trying to do. So you don't want to place it so superficial that you see the thread or you see the gray of the needle. You want to place it just underneath that layer, kind of in the deep dermis. That's where this is going to look really, really pretty. Place one more from up this direction. Pinch. One thing that I did learn is that you definitely, as you're doing this, you want to spin your needle. That does start that collagen stimulation. Also does loosen up the thread a little bit. So I do a little bit of spinning as I'm coming out. That starts and activates the collagen stimulation by twisting the thread, or twisting the needle as it is. Remember, this is a needle with the thread in there. This is not a cannula. So these actually do puncture through the skin. It's a needle point, and that's why it's a 29 gauge, okay? And I do hold a little bit of pressure onto this area just because it is superficial. This one definitely potentially bruises your patient a little bit more so. So when you are doing superficial threads, make sure that you do talk to the patient and let them know they may bruise up a little bit more so. The foundation, the barbed ones are not going to bruise up as much because you're going deeper into the tissue layer. But because this is more into that dermis layer, the deep dermis layer, you're going to have a little potential of a little bit more bruising into this area. But you can kind of see how that really does soften out and really build up some tissue. And remember, the results of these smooth threads is not going to happen. You'll get a little bit of immediate benefits, but really is about a month out, 2 months out that they see some changes in the collagen nature, thickness to the skin, improvement in the quality of skin, and some tightness into the skin with regards to these smooth threads. So don't look at it as something you're just going to do now and see immediate effects. It really does take a little time, kind of like your Sculptra, that it does take time to see your results. You can bring the patient in another a month or 2 months and add another layer. Sometimes I'll tell my patients with more laxity in the skin, it may be 2 or 3 times that we're going to be doing superficial threads to get your skin to a healthier position. Okay, and make sure you do get the skin to a healthier position before you do the barbed threads. That's going to be very important. All right, so we are going to start off with her mesh. I'm going to do a tiny little bit, one right down here. Fill up her nasolabial with one. I'm going to do a little bit right in here for a mesh. Right in here. Let me do another one right in here. Okay, there we go. Stick a mesh in here. Beautiful. Mesh done.